Quick question. Are you taking calcium? Maybe vitamin D? Maybe both, because you've heard they work better together. Good instinct, by the way. But here's something nobody tells you at the pharmacy counter. There's a decent chance that calcium isn't making it to your bones. It's stopping in your arteries, hardening there, right now, today, possibly as we speak. I'm not trying to scare you, but I am a pharmacist, 9 years in, and this is the thing that keeps coming up in the research that most people, and honestly, a lot of doctors, haven't fully connected yet. So give me 12 minutes. Drive, do your dishes, fold your laundry. You don't have to stare at a screen for this one. By the end, you'll understand one vitamin that could genuinely change how you think about your heart health. Let's go. Hello, everyone. Welcome to Quick Question, a podcast where we delve into intriguing topics in just a few minutes. Today, we're talking about something... Okay, theory is nice. Data is better. Let's talk about the first study. Danish researchers took about 300 men, average age 71. These guys already had some calcification going on. Not in crisis mode, but their arteries weren't exactly brand new either. Half of them got a daily combination of vitamin K2 and vitamin D for 2 years. The other half got a placebo. Same pill, same size, same color, nothing in it. Nobody knew which group they were in. Not the patients, not the doctors. That's how you run a clean study. Every year, everyone got a CT scan. They measured how much calcium was accumulating in the coronary arteries, the arteries that feed your heart muscle. Now the top-line result. Technically neutral. The K2 and D group didn't separate dramatically from the placebo group across the whole population. You might think, okay, so it didn't work. But the researchers didn't stop there. They split participants into 2 groups, people with lower calcification scores at the start, and people with higher scores, meaning their arteries were already in rougher shape. In the low score group, not much difference. In the high score group, the placebo group kept piling up calcium steadily. The K2 and D group slowed down noticeably, about 25% slower progression over 2 years. And the pattern was consistent. The worse someone's baseline situation was, the more benefit they seemed to get. That actually makes intuitive sense. If traffic is flowing fine, 1 extra cop doesn't change much. But if there's already a pileup on the highway, getting that cop out there matters. Now here's the part I didn't expect. The researchers also tracked serious health events during the 2 years: heart attacks, cardiac procedures, deaths. In the placebo group, roughly 1 in 15 people had one of those events. In the K2 and D group, roughly 1 in 50, 3 times fewer. The researchers were careful here. They said this wasn't the primary outcome, so it's not a definitive finding. But 3 times fewer serious cardiac events in a 2-year trial is not nothing. That's the kind of number that gets more studies funded. And spoiler, it did.
Here is the thing that trips people up more than anything else. Vitamin K is not one thing. There's vitamin K1 and vitamin K2. They share a name. That's basically where the similarities end. K1 mostly works in your liver. Its main job is blood clotting. Cut yourself? K1 helps stop the bleeding. It's found in leafy greens: spinach, kale, broccoli. Great for what it does essentially nothing for your arteries. K2 is different. K2 works outside the liver, in your blood vessels, in your bones. K2 is what activates those calcium traffic cops. The research here is striking. A major Dutch study followed thousands of people for a decade. People with the highest K2 intake had about 50% less arterial calcification, 50% lower cardiovascular risk, 25% lower overall mortality. K1 in that same study? No effect on any of those numbers. Another study, 16,000 participants, 8 years of follow-up, found that every additional 10 micrograms of K2 per day was associated with a 9% reduction in coronary heart disease risk. K1? Still nothing. So eat your greens is good advice, but it's not getting calcium out of your arteries. Now, one more layer. Not all K2 is the same either. There are 2 main forms, MK4 and MK7. MK4 clears your system in a few hours. It's like hiring a contractor who shows up at 9 a.m., takes a long lunch, and is gone by noon. MK7 stays active for over 72 hours. Show up Monday, still working Wednesday. Almost every clinical study uses MK7. So when you're looking at labels, and yes, check your labels, you want K2 as MK7, not just vitamin K, not K1, K2, MK7. Now, where do you get K2 from food? You'll hear natto mentioned a lot. Fermented soybeans, very popular in Japan. Strong taste, strong smell, not exactly flying off shelves in the Midwest or most of Europe. The good news is there are friendlier options. Aged Gouda cheese, grass-fed butter, certain hard cheeses that have been aged long enough for the bacteria to produce K2. Europeans have been eating these for centuries. Turns out there might have been a reason all along.
1 study is a hint. 2 studies is interesting. 14 randomized controlled trials pooled together? Now we're talking. Chinese researchers did a systematic review. That's where you gather every serious study you can find and run the numbers collectively. 14 trials, over 1,500 participants, multiple countries. 3 findings. 1. Vitamin K supplementation significantly slowed the progression of coronary artery calcification. Across all those studies combined, the signal was clear and statistically significant. 2. The sleeping traffic cops woke up. Researchers measured the inactive form of that calcium-directing protein in the blood. Think of it as a measure of how many cops are still sitting at home. In the vitamin K groups, that number dropped substantially. The cops got deployed. This result was extremely consistent across the trials. 3. Safety. No meaningful difference in adverse events between the vitamin K groups and the control groups. 14 studies, 1,500 people, no significant safety signal. That's actually a fairly big deal. Anything with real biological effects usually comes with some trade-offs. At the doses studied here, which are not extreme, vitamin K2 appears to be well tolerated. The researchers themselves say more and bigger trials are needed, and they're already underway. But the direction across 14 independent studies is remarkably consistent.
Okay, before you close this and immediately order supplements, let me be straight with you about a few things, because I'd rather you hear this from me than find out the hard way. Number 1, if you are on Warfarin or any blood thinner that your cardiologist prescribed, do not add vitamin K2 without talking to your cardiologist first. I'm not saying avoid it forever. I'm saying have the conversation first. Warfarin works by blocking vitamin K activity. If you add K2 on top, it can throw off your levels. That's a real interaction. Call your cardiologist. It's worth a 5-minute phone call. Number 2, Vitamin K2 is not a shortcut. It's not a permission slip to skip exercise or ignore your blood pressure or keep eating like you're 22. Think of your cardiovascular health like a house. Exercise, sleep, diet, blood pressure management, that's the foundation and the walls. K2 is a really good roof, but a roof sitting on sand is still going to collapse. Get the foundation right first. Number 3. The doses used in these studies were generally in the 100 to 360 microgram range of MK7 per day. You don't need to go crazy. More is not automatically better. And lastly, if you're supplementing with vitamin D, which many people in Northern Europe and most of the Northern United States genuinely should be, especially in winter, K2 isn't just a nice addition. It's actually kind of the missing piece. D does the hiring, K2 does the managing. You want both on payroll. So, here's where we land. Most people think the calcium story is simple. Take calcium, take vitamin D. Done. But there's a chapter 3 that doesn't make it onto the supplement bottle. Your body has a system for making sure calcium goes to your bones and stays away from your arteries. That system runs on vitamin K2, and most people in the Western world are running low on it, quietly, with no symptoms, because modern diets don't include many of the foods that deliver it. The science isn't finished, more trials are running, but the direction of the evidence is consistent enough and the risk is low enough that this is worth knowing about. So next time you grab your calcium or your vitamin D, just ask one question. Is there a traffic cop on duty? Because without K2, the whole crew might still be in the break room. Thanks for listening. Share this with someone who's been told to take their calcium, which at this point is basically anyone with a birthday. And I'll see you in the next one.